Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Agahi with your host, Warisa Zainab. In today's episode, we shall be discussing about speech, communication, and language difficulties, how it impacts a person, and what is the best treatment intervention out there for speech and language-related disorders. In today's show, we are going to welcome our guest, Shafaq Hassan, who is a speech and language therapist and has a lot of experience in this field and has been serving her local community for quite some time now. Shafaq, welcome to Agahi.
Hello, Assalamu alaikum. Thank you, Warisa, for inviting me to your lovely show. I'd like to say Assalamu alaikum to all your viewers. I really hope everyone benefits from this show because I'm really excited about it.
Inshallah, look forward to this discussion. Right, so Shafaq, tell me about yourself. For how long have you been in this field and what inspired you to become a speech and language therapist?
First thing I'd like to say, Warisa, speech and language therapy is a very new field for us, for Asians particularly. Coming to this university, I graduated from University College London, and having come across this, in the perspectives, having come across this course, I really wanted to work with people and serve our community, and I thought this was really unusual and it was a really good program. And once I started practicing, alhamdulillah, I realized there are a lot of families in the community who have children and adults who have experienced and suffer from communication difficulties, and I just felt privileged that I can help.
That's brilliant, and there is a desperate need. There's no denying. So in order to understand whether somebody is in need of a therapist, if the child, say, for example, has delay in communication or language, how can parents identify that their child needs help?
Really good question. What happens is, as soon as a child is born, their communication starts. Babbling and crying and any form of sound that they make, that starts. But there are milestones which children need to reach in order to what we say is a normal development. And when that child is not developing as we expect, and their speech is not say by the age of 3 years, they don't have speech which the parents or the family can understand and outsiders can understand, then we have alarm bells ringing, and we would advise children to be, taken to a GP, for example. If they're in the UK, they go to the doctor, or they refer themselves to a speech therapist.
Fair enough. What would you consider as the normal timeline for a child to start speaking?
To start speaking, as a baby, right, once they're babbling and they're constantly hearing sounds and they're hearing adults around them speaking, they're hearing, if children have siblings, they're hearing their siblings speak. So they're constantly acquiring sounds, and when they start the intention to communicate, you'll have baby talk, right? You'll have immature speech, baby talk. They're trying to say mama, they're trying to say, their father's name, baba, or the sibling's name. And when that comes together and parents feel that they can understand their kids, it's usually the family understands their kids, right? But when outsiders fail to understand and communication is difficult, and when a child's time is right to go to nursery, or they're interacting with their cousins and friends, and people don't understand them, and the child starts feeling frustrated themselves, and you have to look out for these signs of frustration, and the family's struggling, and the family usually, their gut feeling is something really good to go by. And so I'd really just generally say the parents and the guardians of the child are the best people to go by, and if they have a gut feeling that something's wrong here, then go by that, definitely.
So what are the signs and symptoms? How can we identify that there is a problem, apart from like your gut feeling that there is something not right here?
Yes, absolutely. After the gut feeling, usually we have the child assessed by a speech therapist, right? One age-appropriate sounds need to be present in a child. So, for example, when a child starts to articulate or express themselves or have their needs met, right, they should be able to do that without saying, I need to go to the toilet, but they have their specific word for the toilet, for example. If they're hungry, they're able to, and communication is not just via speech, gestures, body language, how they're expressing themselves, everything as holistically, you have to consider child holistically and
Yeah.
how they're expressing themselves, and are they understanding first? So the most important thing is the child understanding. And one of the key things that I would advise any parent to do is be vigilant about their hearing, because if they can hear, then they can speak. And usually hota hai ki as kids are growing up, they have lots of colds and flus, right? So given that it's flu season, you'll realize that kids have runny nose, and they have fever, and kaan mein dard hota hai, sometimes they have earache. And if they have a cold and flu, and if pus is built up in the ears, and temporarily, even if a child doesn't hear sounds, then they miss the developmental milestones because they can't hear, and so they can't articulate those sounds. So when they do eventually end up speaking or trying to speak, if they don't have those sounds in place, they won't be understood.
Right.
So those are just red flags to look out for if a child is developing a speech difficulty. The other thing I'd really like to say is a family history. People need to be aware of family history. If, for example, if someone has a speech disorder, if they've had a lisp or a stutter in the family, you are likely to see children in that family to develop a stutter. And for that, people need to be alert about their child's speech. And usually, hota hai ki, few weeks is normal for a child, for any normal person to develop a stutter, but it can, solve itself, fix itself without intervention. But if it goes on for longer than that, then I strongly recommend that a speech therapist is sought. And the speech therapist is able to assess and identify, okay, is this a disorder? Is this a fluency difficulty? Or is it just a temporary thing which can resolve?
So it is hereditary then?
Yeah, there are lots of speech communication difficulties which are hereditary, but there are some speech therapy, rather speech difficulties, communication difficulties, which just appear in a child. And it's our job as therapists to identify what was the trigger for that. For example, I'll just give you an example of autism, right? Everyone is familiar with autism, right? But this is not hereditary, right? And there's no evidence to show that because someone had a speech difficulty, the child has ended up with autism. Or there was a myth that vaccinations cause autism, which is completely false.
Yeah, blame everything on vaccinations.
Especially right now when there's so much talk about COVID and vaccinations, and people are struggling to make the decision whether to go for it. I mean, I've had the vaccination, so I'm all for it, right? But good to hear. Yeah, so I just want to say that people shouldn't be scared, and there shouldn't be a blame game. Usually hota hai na कि people blame कि, oh, because of this, or because you weren't careful pregnancy, or because so and so said something, yeah, कि बच्चे को autism हो गया, and that is not the case. And the more science develops, right, the more educated we become about speech difficulties and disorders, the more we're able to identify and diagnose. So we're living in good times right now, and to be able to diagnose a speech communication difficulty and be able to help that child is really important.
Is it something which is only in children, or is it something that even adults can develop in later life?
Speech therapy is relevant for children and adults. A lot of adults you will see that adults have experienced a stroke. Our grandparents or the elderly, or aajkal ye ho raha hai ki even younger people experience a stroke. And in a stroke, rehabilitation involves speech and language therapy, because adults they can lose the power of speech. Their brain may damage agar hota hai, so they lose a certain aspect, part of their brain. So it's really important for a person who's had a stroke, right? It's really important for any member of the community or the family to be able to spot the stroke. So the acronym FAST, if there's a droopy face, yes. And if their speech is slurred, if they're not able to raise their arm, right? And timing is really, really important. So if you catch a stroke, you're meant to be able to get them to the hospital to get help ASAP, so that more of the person is saved. And by that, I mean that so that, they don't have cognitive difficulties, they don't have speech difficulties, their memory isn't affected. Stroke can be quite fatal, but if caught early enough, then you can stop the damage, basically. So, and other disorders, for example, lots of people are diagnosed with so many things at a later stage because they've been to school, no one's picked it up. They've been to they've been to primary, secondary, they're at university and they're struggling, and you'll find that someone's just been diagnosed with dyslexia or dyspraxia, for example. Dyspraxia is a motor coordination disorder. And lots of people think that, oh, the child is clumsy or they don't pick up on it. But you find out when they're an adult, they've been diagnosed with dyspraxia. They can even get a diagnosis for autism at a later stage because they've been functioning well, but they've always struggled. So, in adults, and in adults, it's acquired. It's usually either you have a brain injury and it affects your brain, and that in turn affects swallowing and affects speech, which is what we're involved in, what speech and language therapists work with.
So apart from stroke, are there any other reasons why an adult can develop some kind of difficulty? For example, shock, trauma, Parkinson's?
Absolutely. Progressive disorders exist. You have Parkinson's, you have dementia. I mean, my grandmother, she had dementia, and we didn't, you don't actually pick it up until you actually know of the symptoms, or you think, hang on a minute, why is their personality changing, or they're having difficulty eating, or their speech has become difficult. I mean, there's so many symptoms which a specialist can pick up on, because for example, if an adult is suddenly having falls, or they're being clumsy, so progressive disorders are developed later on in life, and for that you have a specialist a speech therapist who is a specialist in adults, who can work in that field to help.
So what are the different types?
The different types of?
As in speech difficulties or language disorders?
You have language delay and language disorders. For example, one of the diagnoses, which is developmental language disorder, is that the child doesn't actually have any organic difficulty, and they're struggling with their language, they're struggling with expressing themselves, they're struggling with understanding. So that needs to be assessed, right? And you can have language disorders, speech learning difficulties. I mean, there's such a range of diagnoses, and the important thing is in our Asian communities, I found that people really want to brush things under the carpet, and they don't want to talk about it.
Yeah, this is why we have this program.
Absolutely. And you're doing such a wonderful job of raising awareness, because I think I'm really passionate about raising awareness of speech and communication difficulties. And I think for adults who have children who are struggling, and they identify them with speech or communication difficulty, it's really, really important to be able to support that child. So don't brush it under the carpet. And we are specialists here to help. We're here to help. Our skills are there for our community to help, right? So don't brush it under the carpet. What is it? Why is it important to get a diagnosis, right? You'll think, oh, diagnosis will jayega, and kisi ko pata nahi chalega, no one should find out if the child has a difficulty. It's actually on the contrary, you're doing the child a disservice. If you have the child diagnosed, right, you can provide, for example, if the child is nonverbal, right? If they don't express themselves, they don't speak, they don't communicate like that, like you would think, Jessa, you and I are talking, right? And it's not fair. So there are systems and there are interventions which help the child communicate without the act of speaking. But we do encourage and try and help the child to speak. But for example, if they're nonverbal, then there are other methods of, encouraging them to communicate and have their needs met. So it's a disservice that if they have a diagnosis, especially in the UK, then all these papers are put in place, all these people are put in place to help support the child at school and at university, for example, and secondary school. So you don't want that child to fall behind. Otherwise, they're not going to have a good quality life. For their quality of life, you get them a diagnosis if they have a difficulty, and then see how people can help them, how you can help them. Because the average person, the lay person, doesn't know anything about speech and communication difficulties. And suddenly when the child is diagnosed, they're like, oh my God, all hell breaks loose, It shouldn't be like that, right?
Blaming other things or other people for that child's behavior not being able to speak. That's another thing.
Yeah, that's another thing. And you were asking, another diagnosis which I'd like to just put forward is it's selective mutism.
I was going to ask you just.
Really? Nice.
Yeah. Go on.
Yeah, because recently I had a client, and their daughter was struggling because she spoke at home. She communicated well at home with her parents. But when she went to school, her school teacher said that, she doesn't speak. There's no communication. She needs help, and the parents refuse to accept it, because if you can imagine, if your child is speaking fluently at home, but when they go to school, so basically, as a specialist, I dug around, investigated. So that's one of the most important parts of my work, is investigating and identifying reasons why that child is not speaking. So ye hua tha that the child had a lot of movement in her life. She had a new school, a new house, a new country. Parents had started a new job. So a lot of changes, right? And all of that mixed together basically resulted in her system going to shock, basically.
Yes.
So she lost her friends from her old school. I mean, everyone has a best friend, So she lost her friends from her old school, moved to a new school, home changes, parents are working. So I think for a child, that was a lot to deal with.
Yes.
So that child was selectively mute at school, and it takes a lot of work from the teachers and from the teacher assistants to help that child adjust. And there are things like that which present in children, which mostly go missed, and teachers will just say that, oh, they have a problem, or the child is lazy, they don't want to socialize, they don't make friends. And you have to be able to understand, come down to the child's level and find out, investigate and find out and connect with the child and see what the problem is, what's going on, why they.
I've also seen this pattern in adults, like in the refugee population, who have witnessed like horrific tortures or crimes or conflict.
Absolutely.
And have gone into like trauma and shock, and suddenly they're not speaking, they're not communicating anymore.
Yep, post-traumatic stress disorder.
Oh yes, yeah.
Absolutely. It's really heartbreaking. It's really heartbreaking. And refugees coming into another country, and refugees and in the camps, it's very, very difficult, and it can affect them emotionally. Like you've seen yourself, Warisa, it can affect them. Their mental health is affected, and mental health it does affect your communication and your speech. It does affect, and it goes in really deep. So it's not just a speech therapist. They need a multidisciplinary team approach to help them and to assist them. So I find that really hard to deal with, when people have gone through difficult things. And like on an average day, if someone has been through a difficult experience in their life, for example, the loss, grief, the loss of a parent or the loss of someone significant in their life, you'll find that an adult will start stammering, or they won't be, they won't be fluent in expressing themselves, or they'll have a memory gap in what they're doing. They might forget. So it's really important to be educated and aware about these issues, which can affect an adult and they can affect children alike.
What about those individuals, Shafaq, who are really good at speaking and communicating when it comes to familiar groups or people, for example, family members and friends? But when it comes to public speaking, or going for a job interview, or speaking in front of a higher official, suddenly they start to stutter, they stammer, loss at words, things like these, and they can barely complete a sentence.
Totally, I can totally understand that. And usually that the anxiety and the stress of going into a stressful environment for them, it can affect their breathing, and it can affect how fluent they are. Like you're saying, they start stammering and stuttering, and some people do need help for public speaking. And it's just a tongue tie ho jata hai bilkul, and because I mean your channel is so brilliant, right? It's like, if you look at Musa alayhi salam's story, Allah Ta'ala gave him a revealed surah, the verse that he can say so that he can speak to the Pharaoh, because his tongue was tied. Exactly. Right? So he had trouble speaking. And the thing is that, taking inspiration from that story, it should be that it's acceptable that speech and communication difficulties do happen, and you have faith in Allah, and then you put your faith in science and professionals who can help you, that. And yes, when you have a difficult situation and an interview situation, on an average day, you would say, okay, say Bismillah, go for the interview, and everything will work out. But people who do have more significant difficulties, like you're saying, that they start stammering and stuttering, either they can see a speech therapist who can help them deal with that anxiety and help them with breathing exercises, which is normally incorporated in speech therapy for stammering. And they can also take, support and advice about interview practice, really. But you're right, it is a very real problem.
I'm so pleased that you gave an example of Hassan alayhi salam, because there is another stereotype and stigma that still exists in our communities, that if someone is suffering from any disorder, not just speech or language, but any disorder, straight away people start judging their iman and their faith, and you think like you're not praying hard enough or you're being punished for your sins. Although we have these examples, of the prophets or even the companions of the prophet, like Hazrat Bilal, he had a speech difficulty, but still the prophet chose him to give the azan.
Exactly.
So why can't we accept people in our community who have these kind of difficulties or disorders and include them, rather than putting them away, in a corner?
You're right. Absolutely, you're right. And in my professional world, that's what we're discussing right now, is diversity and inclusive, being inclusive and equitable to people who have speech difficulties. So if someone is diagnosed with a difficulty, let alone not just speech therapy, if they have any other problem, it's not a matter of koi saza de raha hai, Allah saza de raha hai or something. It's a test from Allah. It's a test from Allah, and our community needs to be a bit more open-minded and accepting. And rather than pointing fingers and pushing that person out of society, offer them a job, give them support, see how you can help them, rather than be like, they're not part of our community. I mean, a couple of years ago when COVID hadn't come, right? It was for Jummah Namaz. When we went for Jummah Namaz, it was in the it was in the common in the park, right? Because there mashallah so many people. And there was a family, there was a special needs child in a wheelchair, and that child was causing disruption because they were vocalizing at a time when it was inappropriate during namaz. And lots of people find that really hard to understand. Okay, there's a family here, they have full right to come and be part of Jummah namaz, right? And if you're gonna be like, why are they here? They shouldn't have brought their child, and they have a full right. As a community, it's our responsibility to include them. To be part of namaz rather than shun them away. For Eid, festivities and all that, include them rather than pushing them or shunning them away. I mean, in Turkey, you have the mosques jo hote hain, the grounds jo hote hain, it encourages children to be running in the mosque. And isn't there a hadith that says that Rasulullah, it's like, if the mosque is quiet and there's no sound of children playing, then that mosque should be a center of the community, that children are visiting, elderly folk are visiting, and you can't just shun it, give us namaz, and it should be silent. And you have to be inclusive. Rasulullah sallallahu alaihi wasallam, he did not shun people away because they had health issues or speech difficulties. I mean, our deen is so inclusive. It's such a beautiful deen, right? So you can just hear me going on about this.
No, I'm equally passionate about it to go on. I mean, because Shafaq, at the end of the day, we both have the same intentions, that one, we need to kind of educate our community when it comes to these issues, and second thing is we need to break away from the stereotypes that exist. Because you are a therapist, you do this like every single day, right? You helping people. So there is hope. So people shouldn't lose hope that, if my child has this problem, or if someone in my family is, experiencing this is the end of life. No, there is help out there. There are people like you out there who are like working hard to help people with these kind of difficulties.
Alhamdulillah, alhamdulillah. I mean, that's our goal, isn't it? Our goal is to improve people's quality of life, to help support them. And the thing is, because we have this opportunity to gain information and to educate ourselves, and science is making so many leaps and bounds of advances, right? So it's like more of us are becoming aware, and we're able to diagnose and identify. I mean, 20 years ago, it's like autism. What is autism? How many of us knew about autism? How many of us knew about dyslexia, dyspraxia, dysarthria, which is another speech difficulty that a person who's had a stroke is going to have. Their speech will be slurred. How many people knew that a person who's had a stroke is not someone who should be just, tucked to the side of the house and they're bedridden and you can't do anything? I mean, now you have physio, you have OT, you have the doctor consultants, you have speech therapists, and a person who's experienced a health difficulty, they have full right and ability to be helped so that they can come back and be a functional or productive person, part of life.
Mm.
So yeah, I just really like to tell your viewers that, just because a person has experienced a health issue, don't just, tuck them to the side of the house, push them to the side of the house, that's it. They're not a productive member of society and community. It's like they're rich in information and experience, and it's our job to make them, feel a part of the family and feel a part of the community, inshallah.
Yeah. I also wanted to ask you, Shafaq, with different kinds of speech disorders that exist, is there a possibility that one person can have a learning disability alongside speech disorder?
Yes, they can. Yes, they can. And as a specialist, they will need to be seen by a specialist who can, as we call it, differentially diagnose, what difficulties they have, because having two disorders, you'll have to be able to identify that what are their requirements to help them communicate properly. And these days, speech therapy, there's another new thing that's happening, is that you have speech therapists who are working with prisoners. So you'll have members of the public who've, God forbid, they've committed a crime, they're in jail, and they don't understand when the people in jail are telling them that, they're not allowed to leave the city, they're not allowed to do this or that. And if they have a learning disability, they don't understand all that. So they will mess up again and again and again. And I think, not just for Muslims, for people in general, the speech therapist is getting really involved with the judiciary system to help prisoners who have a learning disability. They can't read or understand or write, and they may have expressive issues, anything concomitant, difficulties, which makes the situation more harder for them to manage. So yeah, so it's like we differentially diagnose and find out pinpoint what difficulties they have. And speech therapy, right? It's not just a matter of just going to the GP and getting a diagnosis and coming back and knowing, yeah, I have this difficulty. As speech therapists, it's our job. It's like we used to offer a block session of therapy for 4 to 6 sessions, in which we identify, assess, and work on some goals that we need to achieve by the end of the therapy session. But because, like you're saying, it could be more than one issue, right? So we have to identify, revisit our goal setting, and with the client, with the patient, identify that, in the longer term, will it take more sessions to work with the client so that they can achieve their goals? And we're consistently revisiting and revising, so that it's not just that we're wasting time and just working with the patient. We want to make their needs be met. And we want to support the family's mental health as well as the patient's mental health. Because if a child has, issues, difficulties, communication difficulties, what are the parents going through? I mean, in for example, in Pakistan, you'll have lots of people who are very active YouTubers who've talked about their personal experience, who I'm following as well. And they've had a child who's had, for example, Down syndrome. And the community, there's not enough support available for them because people don't know enough about it and how to help. And usually they have to go abroad, West America for treatment, or the UK for treatment. But there's so much awareness now, right? And specialists are they're getting trained so that they can help children who've, a genetic disorder, they have speech difficulties, they have feeding difficulties. If they have a cleft palate, for example, they'll have feeding difficulties, they have the surgery, and then what next? How do you help them next? So it's not a matter of that. It shouldn't be that there's not enough information and support available. There should be enough information and support available. And if there's not, there are always helpers. So definitely look for support and help from specialists, who are always people around who can help.
Are there any support groups for families, for people who are going through this?
Of course, definitely. There are lots of support groups. In the UK, I know there are lots of support groups, and I know, I'm giving an example of Pakistan, but there's Pakistan and India, in Asia, and in the US, there are lots of support groups which are there. You'll have adults who have got communication difficulties. For example, if someone has multiple sclerosis, right? It usually affects, it can affect multiple aspects of their being. So there are lots of societies which are out there. If you just have to reach out and, you know, talk to a friend. If anyone is afflicted by any communication difficulty, it's not that you're being punished, like we've said earlier. It's not like you're being punished, but maybe it is a test, or maybe it's how to help you grow as a person and empathize. So empathize is a really important aspect of a person. Empathize with people who are going through a difficult time, and show them support. And there are support groups. There are lots of support groups out there. There's a stroke support group. There are support groups for people with hearing difficulties, because hearing has a direct impact on speech. If you can't hear, you don't develop properly, your speech doesn't develop, your language doesn't develop, you're not speaking properly, right? So it's a bit of a pyramid system where like, for example, you talk about children. As they grow older, they hear the right sounds. They hear the p, b, t, d. The s develops at a later time. So if they're hearing this age appropriately, they'll be able to communicate and speak age appropriately then.
So is there a difference between speech, sound, and language? Because my understanding is language is like Arabic, English, Urdu, right? So how do you...
It's a foreign language. Yeah, it is different, because if you think about, even within Urdu, Urdu and Arabic, the linguistics of how you speak, the language, the words you put together, the string of words that you put together, that's what we refer to as language difficulties. If you're not able to put the correct string of words together, right? And that's basically what you're learning at school, and it can be a clinical reason why you're not being able to do that. And speech, your articulation is all the sounds that you're able to make with your articulators, which is using you have your lungs, which provide the power to speak, and then you have your larynx and your vocal folds, which is voice is something I've specialized in. So I've done a master's in voice pathology, right? So the voice, to be able to speak properly, I mean, if you have, for example, anything wrong with your voice, right? For example, if you have a cold or a flu, and there's not enough mucus on your vocal folds, you're not going to be able to articulate properly. So your speech is affected, your voice is affected. You can lose your voice, for example, if your vocal folds have, for example, if they have a spot on it and your vocal folds aren't closing properly and opening properly at the appropriate ways, you're going to be husky. No one's going to be able to understand you. No one will be able to pick up what you're saying. So, and then there's the whole articulators, which are your tongue and your teeth and your nose. So you use your nose to make sounds such as ma, na, nga. And Urdu mein and Arabic mein and any foreign language, they are foreign languages which have a linguistic system which uses words in a certain way, in a certain pattern, right? So that's really important for language development. And speech and articulation is using your articulators to make the right sounds, like pa, ba, ta, da, ma. You have those sounds in other languages too, right? But if you have a difficulty to articulate, for example, if your tongue doesn't move as efficiently as it should, so in any language, you're not going to be able to make the sound, right? So you have to be able to identify whether, like, for example, lots of people say bilingualism. That's a big key issue as well in speech therapy, that people think that, oh, because the child is speaking 2 languages, right, they're going to have a speech difficulty or language difficulty, so drop the mother tongue. And we're huge advocates for saying to people, do not drop the mother tongue. It has nothing, bilingualism has nothing to do with speech and language difficulties. Right. So if for example, you speak, Arabic, if you speak Tamil, if you speak Gujarati, hold on to your mother tongue, because it's very valuable and it's very precious, and it helps you hold on to your culture as well. And I think that's really important, especially living in the West. It's really important to hold on to your roots. So bilingualism has got nothing, evidence has shown that it has nothing to do with a speech or language disorder or a delay.
You mentioned something about swallowing, and I know I've heard this from some people that they find it difficult to swallow, for example, tablets or pills, and it has to be a certain size, otherwise they can't, which is quite difficult to understand. That why is it you can swallow a morsel of food, but they find it difficult to swallow, for example, a pill or a tablet.
Absolutely, absolutely. And it's a huge area in speech therapy, right? And the pipe, you're right, your pipe and anxiety, and the brain sends messages to your food pipe about swallowing, and your tongue is involved in swallowing. So some tablets, you'll find paracetamol tablets, some are round, some are oval shaped, and some are capsules. So different people have different sensitivities and how the brain reacts to having that tablet. And some people, for example, if they have eating difficulties, right, their tongue is not managing the consistency of the food, right, or they get anxious and the muscles around the neck, they constrict and they become really tight and you can't swallow on time, you'll choke, right? So what in medicine, there's the option of having syrups, for example. Children do not have the ability to swallow tablets, so they will have paracetamol or Calpol syrup, right? Adults may have, you'll find in some packets it says you can break it in half so that it's easier to swallow. So it's all about the coordination of your muscles, and your tongue is the strongest muscle in the body, believe it or not. So the tongue, the coordination, and how it creates a bolus of when you're eating. So swallowing tablets can be tricky because, and the consistency of food can be tricky for some people to manage, especially if they've had a stroke or they have a muscle or motor disorder, which makes it hard for them to swallow. And normally you'll see that as people age, aging is a huge factor in muscle weakness. So if you have muscle weakness, that's another reason why you may have difficulty swallowing, and that's normal, right? As you age, it's normal, but there are ways to adapt yourself and adapt your food and what you're eating and drinking to help you, maintain nutrition and eat and drink and enjoy life, really. Because as you grow old, as your grandparents get old and all, you don't want them to, not enjoy the quality of life that they're used to. So yeah, it's a huge area.
Are there any exercises for example, stuttering or stammering or
Yeah.
Uh-huh.
Yeah, absolutely. So there are breathing exercises, for example, stammering and stuttering, right? And I mean, there are different approaches, but I would say that one of the things that we are really keen in seeing is that the tongue movement, is the tongue moving appropriately? When a person speaks, there are tests that we do to see if the tongue is moving from left to right. Is it coming forward? Is the tongue agile enough? Is there coordination movement in the tongue? So breathing exercises, and usually depending on what the problem is, if it's a motor disorder, then you will have you will have muscle exercises which will help you articulate. If it's not a motor disorder, if it's just if the etiology, the reason why you have a speech or communication difficulty is something different completely, or some different organic reason, muscle exercises will not help, right? If the etiology is because the brain is wired differently, for example, if a child is autistic or has Down syndrome, the muscle, some exercises will not help. For example, Down syndrome, I'm not an expert in completely, so I wouldn't want to say anything there. But for autism, for example, if you say muscle exercises, and it depends. I mean, it just depends on what's been affected and how best we see how we can help them, really.
So how do you distinguish between an organic brain disorder or something which is something to do with the mind or psychology?
You have your assessments. Like for speech therapy, we have standard assessments, right, for differential diagnosis. You will have, for example, if someone has has a condition which affects their brain, you have your assessments such as doing the MRI scan. You have scans which help identify, which help doctors and specialists identify if there's something going on there. And yeah, and it's just how they perform. Do they have a diagnosis of an illness? When a child is born, you have all the health visitors and who are doing checks on the child to make sure that there's movement. And if there's a diagnosis, then you will pick up on traits that if there's a communication difficulty. So it's usually just how they're performing in the world. And you have assessments which are formal assessments, informal assessments, and we observe how people are doing in the community and how they're functioning and how they're communicating. I mean, going back to speech therapy, it's like how they're communicating, and you have your formal assessments, your informal assessments, and you do observations, and you have, for more extreme situations when there is a diagnosis, cerebral palsy, for example, it's visible, right? It's visible, and you have to have your scans, and the doctor, the consultants are key in identifying what the diagnosis is of that person. And again, it's a multidisciplinary approach, right? So everyone gets involved in helping as best as we can.
So when it comes to helping, how can the family help that specific family member who is experiencing this difficulty? What can they do to support?
That's a brilliant question. the first thing they can do is not panic. Lots of people panic, right? Be accepting, be accepting. Mental strain from a diagnosis is huge. So what you first, the family members need to do is educate themselves about the condition and talk to specialists, because and it's not a matter of just hearing it once and being able to accept it. It's really difficult to accept a diagnosis, and people do need to hear it again and again so that the information sinks in. And for any specialist, they should not get annoyed at having to re-explain what the difficulty is and how it's going to affect that person. So the family needs to equip themselves emotionally with being able to help the person, the child or the adult who's gone through a difficulty. And it's a huge strain, if someone's had a stroke. I've got lots of clients I have, who are going through the difficulty of accepting the fact that the person has had a stroke and how to help them. So repeat information. For specialists, it's repeat information. And for the family, ask questions. Don't be scared to ask a question. Don't be scared to again ask a question if you've not understood, or if you've understood and it's hard to accept it. Ask questions and don't be shy of it, and give yourself time to accept what's happened, because everyone is having difficult times. You don't know everybody's story, but be empathetic towards each other and towards the person who's been diagnosed with the difficulty, but go easy on yourself as well, because it's a lot to deal with.
Does it impact like relationships between, say, for example, couples or siblings or just family in general, if someone suddenly develops this?
Yeah, I think it would, wouldn't it? I mean, psychologically, if you think what a strain it puts on people, and their communication. For example, if a husband and wife have a child who has a communication difficulty, and the husband and wife, their relationship is under pressure and strain psychologically, it's going to put a strain on the marriage. For example, if the in-laws aren't accepting, or if the in-laws are pressuring the husband or the wife, I mean, it depends on how strong their relationship is. So psychology has a huge impact on this. It's a huge component of being able to manage, like it's a whole holistic issue, and it's the whole family is involved and affected by this, and family and relationships do break down. But as we are raising awareness of these issues, and so we hope that if people are struggling, they will reach out for help and support rather than let their relationships break.
For children who are born with these disorders, is there any way it can be prevented during pregnancy or before conception? Or is it something that's beyond your control?
No, what I would say is, during pregnancy, right? Look after the woman, look after her needs, look after her emotionally. And when there's a genetic disorder, there's nothing anyone can do in that sense, because when the child is born, that's when you find out, unless they've had their scan and they've had an in-depth scan. Look after a woman, her blood pressure, her eating habits and needs. The woman herself needs to look after. Don't smoke, don't take drugs, eat healthy, and the emotional status of a woman should really be looked after, because I mean, there are so many cases of men and in-laws and men not looking after their wives when they're going through a pregnancy, or even, when they're not in pregnancy, for example. But when you're pregnant and you're having a baby, look after yourself, because it's having a direct effect on the child, right? But at the end of the day, the underlying message is that it's no one's fault, right? I mean, overtly, obviously, if you have alcohol, it's going to affect the child. If you have drugs, it's going to affect the child, right? And
if you're not taking those drugs, or you're not smoking, or you're not consuming any substance, what if your partner or someone else in the household is, and you're like a secondary smoker? So these are the things that you need to kind of take into consideration.
Of course, yeah. I mean, your partner, and the other thing is, being an abusive partner is not going to help either.
Yeah.
You have to. What can I say?
Yeah, I've seen so many clients who were either psychologically, emotionally abused during pregnancy, physically abused, and then they ended up giving birth to a child with some form of complications, or disorders, and it's something you can't reverse.
You can't.
But it happens, unfortunately.
Unfortunately, it does. And the thing is, do your part. Do your part. Look after the person who's having the child. If there is a family history of something, be aware of that. And if God forbid a child does have a difficulty of any sort, don't do the blame game that, oh, if I had done this, this would have happened. It's up to Allah Ta'ala, right? If a situation arises, it's up to Allah Ta'ala, and it's up to us to yeah, to take care of the situation, rather than, like you're saying, let the strain come on the relationship and families breaking down. You don't want that. You want to work together as a family to support the person or to help the person. It's not a blame game, but when evident things, if you can avoid taking negative actions towards a person who's expecting or towards a baby, even after the child is born, keep the atmosphere in your house light and friendly and healthy, so that the child does not experience trauma and too many changes, which will, they can have stuttering or traumatic disorder of any sort. I mean, it's a whole thing. Just, try and maintain positivity and hope for the best always.
What about motor speech disorders? How are they different from language and
motor speech disorders? For example, if you talk about something like dyspraxia, you don't have coordination of speech sometimes. Some people have it more severe and some people have it less severe, right? And you might find that kids will have difficulty getting through school, or you might find that kids are clumsy because they have issues on their limbs or their joints or something. So I think it's really important. For example, even with teachers, they need to be aware that students can have these difficulties, and to have support systems in place. And with support and with therapy, there can be so much improvement, and it can really help the mental health of the person experiencing the difficulty. So yeah, and it's like I'm saying, you have to have team support. You have to have the right professionals in place, and the family needs to educate themselves on how best they can support that person.
So children, children with, say, for example, apraxia of speech, what is the best treatment intervention out there?
You'll have specialists who have specialized in that area, right? And best treatment, I think there are models of therapy which are applicable specifically to people who have motor difficulties. And like, for example, like I do voice, right? So I work with people who've got voice difficulties and all that. So you will have a specialist in dyspraxia and apraxia of speech, if you want to call it that, and how best to help them. And the thing is, remember, therapy takes time. There's no magic wand that's it, you'd have a pill and you're sorted. I mean, lots of moms, lots of parents and lots of fathers will think, oh, treatment ho jayega and that's it, sorted.
Yeah, a couple
There's
of
a process for everything.
Yeah.
Yeah, so there's a process for everything. It takes a little bit of time. It takes a commitment.
Yeah.
And just positivity and hope. And if and there's always, science is always developing. There's always some treatment around the corner. There's always some therapy around the corner. There's always a therapist who works for you, like chemistry wise, that the child bonds with the therapist. And there's some therapists who you totally are not able to work with, and that's okay. It's okay to say that, okay, this therapist is not working, we need someone else. And every patient has a full right to get a therapist who they feel comfortable with. So it's not a matter of that, oh my God, I'm stuck with this doctor or this therapist, and what can I do now? I'm stuck and I can't ask a question, or I don't feel comfortable talking to them. And that should never be the case. I mean, you should always be able to change doctors or therapists without any hard feelings.
So, for example, if somebody doesn't want to go through the route of going to their GP and then getting a referral, say, for example, somebody wants to see you directly for their child or a family member, what's the best way forward?
Best way forward is to contact a speech therapist, self-referral. So, for example, for myself, I have to be a bit cautious as well, because, so it's usually social media. People contact me through and word of mouth. So I don't actually advertise my services as such, because Alhamdulillah, it's been word of mouth that I've been able to get clients. And for me, because I'm bilingual, right, I had personally thought that I was going to get, lots of Urdu speaking and, Indian Asian therapists, patients rather. And Alhamdulillah, it's been a blessing, because I've been approached with people from very different cultures and backgrounds. And the fact that I'm bilingual myself, I think, and I encourage it. So I've found that I've gotten a very diverse client group who approach me for speech therapy. So it's usually, I'm on Facebook, I'm on Twitter, I'm very active on Twitter and on Facebook. And if people want advice, they can always contact me via social media. So you'll find me on Instagram, you'll find me on Twitter, on Facebook, and usually I do my best to respond as soon as I can.
Thank you for that. Do you get clients who come to you with, say, for example, the presenting problem is speech difficulty or language disorder, but then
Yeah.
as a result, they also have depression or anxiety or panic attacks?
Yes, yes.
So,
I personally just work with kids, right? I don't work with adults per se, but I do consulting. I do a lot of online consulting and I do international consulting as well. And yes, so what happens with speech therapists is that if there is another associated difficulty, such as depression or anxiety, then what we do is we refer back to the GP for them to contact a specialist. I mean, even if someone has a hearing difficulty that we've identified that this adult or child has a hearing difficulty, then we will recommend and ask them to get a referral for a hearing specialist, to get audiologists to check their hearing, and then get back to us. So yeah, it's a lot of referral and it's a lot of negotiating and it's a lot of working with other professionals to make sure the right tests are done and the right support is given.
what about Tourette, or is it something totally different?
Sorry, what?
What about Tourette syndrome, or is it something totally different?
It's not totally different. Tourette's is really interesting because I'm so sorry. I think someone's calling. Yeah, Tourette's is really interesting because I mean you'll see that there's been lots of awareness raised about it as well in media. Like there's been movies and there's been, you know. And the thing is that having Tourette's syndrome does not mean that person is not capable of doing anything. So Tourette's syndrome usually will be an involuntary sound coming from the person, an involuntary movement coming from the person is not able to control themselves. And I mean, I've seen people who've had Tourette's and they're holding full-time jobs and they're working, and although it's really visible and that person needs support, what is really good to know is that they're able to be productive, active members of the community. And yeah, it's not just that that person has a label and just they're not able to do anything and push them to the side or brush it under the carpet and no one should know about it. You know, people can be active members of the community if they have the right support. So then again, it's a disorder and you'll have a specialist who's experienced in working with a client with that diagnosis and the right support, with the right support in place, you know, anything's possible really.
Of course, of course. Any final message you would like to share with our viewers?
Thank you so much, Waris. I've really enjoyed doing this show, and I just want to say that, like, I mean, the whole message is raise awareness of communication difficulties. Don't let it strain your relationship. There's always help out there, and speech language therapists are wonderful people. And if you ever need support from a speech therapist, get out there and contact them, and don't be shy, and don't reach out for help. Yeah, that's it. Thank you so much.
Thank you so much. You've been a gem. We really appreciate like taking the time out and you know, covering this topic. Once again, Jazakumullah khairan, Shafaq, and wish you all the best with the work that you do. For our viewers, inshallah, we'll see you again next Saturday with another episode of Agahi and spreading awareness about mental health and psychological well-being, because mental health matters. If you have any questions, if you have any comments or feedback that you would like to give, feel free to contact our studio. You can leave your feedback and comments on our Hidayat TV's Facebook and YouTube page. Inshallah, we'll see you next Saturday. Till then, look after your mental health. Assalamu alaikum wa rahmatullahi wa barakatuh.